Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Kamlesh Sarkar, who is a director in National Institute of Occupational Health, Ahemdabad. A very warm welcome to you, sir, on behalf of all the audience.
थैंक यू।
और आज हम और आज हम बात करने जा रहे हैं ऑक्यूपेशनल हेल्थ के बारे में कि ऑक्यूपेशनल हेल्थ मतलब हमारे व्यवसाय से जुड़ी जो बीमारियां होती हैं। कई सारे ऐसे व्यवसाय हैं जो जाने अनजाने बीमारियों को न्योता देते हैं। दे इनवाइट द डिजीज unconsciously or unconsciously. So we will talk about the occupational health diseases today. And first I would like to start with the first question that what is silicosis, sir? Silicosis क्या है? क्योंकि जब भी हम occupational health disease की बात करते हैं, ये silicosis ऐसी बीमारी है जो सबसे पहले दिमाग में आती है। तो silicosis क्या है, sir?
Yeah, silicosis is one of the most prevalent but neglected occupational disease. We have in India, we have more than 500 million, that means more than 50 crore workforces, and more than 90% of them are in unorganized sector workers. And a sizable number of them, they are suffering from silicosis. Silicosis is a dust-related lung diseases. The people who work in different mines, particularly coal mines, stone mines, then various other industry like construction industries, in the slate pencil industries, ceramic industries, thermal power industries, they continuously get exposed to the dust which contains various amounts of silica. And this silica, when it enters into the lung, it inflames the lung tissue, and ultimately lung tissue gets damaged and fibrosed. Gradually, after a span of maybe 15 years or 20 years, they become breathless. And even at the end stage, even on rest also, they become highly dyspneic or the breathless. And there is no effective cure, there is no effective treatment for this disease. The only thing is the prevention. Another important thing is that most of the occupational diseases are incurable. And so early detection and prevention, this is known as secondary prevention. Once the disease has already occurred, but if we detect at very early stage, it is known as, and then we try to prevent it, is secondary prevention. So secondary prevention is the only hope and only realistic solution for control of silicosis.
Okay, sir. So why is it important to know about it? Just because it cannot cure?
Yeah, silicosis is important because we have a huge number of workers who are suffering from silicosis at various stages. If you go to various villages, different villages of not Uttar Pradesh, Rajasthan, Gujarat, Madhya Pradesh, Chhattisgarh, you will find lot of young widows there in the villages. Their husbands, they died at very premature age, at the age of 40, 45, 60, and leaving their widows and children behind in the village. So, a good, and if you go to the Rajasthan, Gujarat, Madhya Pradesh, Chhattisgarh, the government needs to pay a huge amount as compensation, because as per law, if a person suffers from silicosis, the government needs to pay some compensation, and when he dies, government needs to pay some pension and further compensation. So government pays a huge amount of money just for giving compensation due to silicosis and due to death due to silicosis, but there is no attempt to prevent this disease. So we need to prevent, and the authority is also little bit, not little bit, fully reluctant to for about control of this disease.
So, for being an expert, sir, being an expert, being a director of ICMR, what do you suggest? According to you, what should do for its like for its control?
Yeah, actually, silicosis is important. Definitely, the good number, large number of people are getting affected, and they died because of disease. But because of another important reason, see, we have a huge burden of tuberculosis in the entire world. The 1/4 of the TB burden is in India, and recently, not recently, sometime back, the Ministry of Health, Government of India, they declared elimination of tuberculosis by 2025. 25 is nearby. Now it is 22. After 3 years, it is 25. So by 2025, we need to eliminate tuberculosis from the country. But problem is that the silicosis, it has an important comorbidity is tuberculosis. If a person suffers from silicosis, he will develop tuberculosis also because there is because of silicosis there is a continuous destruction of lung immunity, and when there is a destruction of lung immunity, we develop tuberculosis because as India is an endemic country, most of us, almost all of us, like you, like me, we have the tuberculous organism, that bacilli organism inside our chest. But because of our body resistance is okay, we do not develop. The disease is arrested by our immunity. But when the lung immunity declines, the bacteria will flare up and will start suffering from tuberculosis. So many of the tuberculosis silicosis patients, they are suffering from tuberculosis also. Silicosis patients, they suffer from tuberculosis that is known as silicotuberculosis. So control of silicosis is not only important for control of silicosis but also for tuberculosis also. As we have a huge burden of silicosis, it is estimated, though it is a gross underestimation, but it is estimated that more than 1 crore patients they are suffering from silicosis. But actually, it is underestimation, we believe. The mechanism, the estimation methods are not very well built based on scientific rationales, and so it's a underestimation. Actual estimation would be much more higher, twofold, threefold, or some other three, fourfold, much higher than that. That's why control of silicosis is important for control of both silicosis as well as tuberculosis. The other complications of silicosis are the nephropathy, that means kidney disease. The person who suffer from silicosis, they will also suffer from kidney disease, then the lung cancer, then the cardiovascular disease, then the stroke, cerebrovascular disease. These are the complications of silicosis, the comorbidity you can say. So it has a these number of facets. We need to control silicosis because of these reasons. Another thing I am telling, our country's economy and productivity, these these people, they are linked with our country's economy and country's productivity. So to improve our country's economy and improve our country's productivity, the control of silicosis is very much important.
But sir, what should we do? How to control? I mean, the silicosis is the thing which, like, a person work in a industry, so he cannot leave the job for his
Yeah,
livelihood. He have to.
actually, yeah, I'm telling you that actually in our institute, the National Institute of Occupational Health, we have identified a marker, or you can say biomarker, by which you can detect this disease at very early stage. Provided a person is screened periodically, once or twice in a year, if a person is screened with that biomarker, which we have discovered and explored, that is a simple protein, a protein which is secreted from the lungs, that is known as CC16 or Klebsiella 16. If we know the normal value of CC16, but when there is a progressive destruction of lung tissue, the CC16 value gets declined. So if we come to know that the CC16 value is this, that means he is suffering from lung disease. If a person with history of silica dust exposure, if he is screened every 6 months or every 1 year by either the industry where he is working, the medical facilities by of the industries where he is working, or some unorganized sector workers, he should go to the nearby primary health center. There, all the primary health center doctors of the country will be trained by us and by some other agencies how to test that CC16 and the biomarker testing. And by that, we can detect it at very early stage. And once it is detected, we can minimize further exposure by applying the mask and then by dust sucking machine, etc. So that we have already chalked out So there is a need for the National Silicosis Control Program, just like National Tuberculosis Control Program that we have suggested. And since we are from the Indian Council of Medical Research, the biomarker we have identified, then we have also developed a kit, point of care test kit, just like pregnancy test kit. We have developed a kit. In that kit, just taking one drop of blood from the finger, if you put on one drop of blood, within 10 minutes it will tell what is the how is the state of our lung status, lung health, by examining CC16 value. We know the CC16 value at different stages, in the early stage of lung damage, the moderate stage of lung damage, and the late stage of lung damage. So that we can identify. So ICMR, Indian Council of Medical Research, has already commercialized, and hopefully it will be available in the market soon. Hopefully it will be available in the market soon. And it will be implemented all over the country, that we are hoping.
That's very great, sir. That's really sounds very great that we are developing this much. And but sir, what are the challenges and what is the role of NIOS in controlling this?
Challenges that I have told that silicosis is a neglected disease. Even the TB control program managers and many people, many of us, even the professionals also, we have very limited knowledge about silicosis. Then the doctors, even the five-star hospital doctors like Apollo Glengales and other big hospital doctors, they are not trained in diagnosis of silicosis. The medical officers who are working here and there, they are not trained in diagnosis of silicosis, because in our medical curriculum we are not trained how to diagnose silicosis by seeing chest X-ray. Conventionally, silicosis is diagnosed by seeing chest X-ray, but unless doctor is trained, it is very difficult to diagnose silicosis by seeing chest X-ray. That's why in the various parts of the country, the silicosis is misdiagnosed as tuberculosis, and patients are often treated with anti-tubercular drug without any success because of misdiagnosis. So that's why the medical curriculum needs to be changed and improved for diagnosis of silicosis. Second thing, government has to be sensitive, and there should be commitment from the government of India, Ministry of Labor, Ministry of Mines, Ministry of Health, Ministry of Industries, all should work together. The problem is the labor department, these workforces are under Ministry of Labor, and health is under Ministry of Health. So nobody bothers about labor department. They tell that this is the health related issue, and health department tell it is the labor's welfare. So nobody takes care of these unfortunate workers, and it is in between. So these kind of things to be avoided. So there should be commitment, and there should be well coordination among the various departments: health, labor, mines, industry, etc. And another important thing is primary health center doctors. They need to be trained about it. There should be the work training material that we have developed. National Institute of Occupational, they have developed a training material to train primary health center doctors of the country, and the first batch we have already trained. And after that, this COVID crisis came, so we had to stop. But once COVID crisis will be over, again we will start giving this thing in batches for the entire country, batch by batch. So our role is basically we have identified the biomarker, we have developed a kit, and we have developed the training material. We have started giving training of the primary healthcare doctors. Now we are trying to push government of India to initiate national silicosis control program for dual benefit of both control of tuberculosis as well as control of silicosis. That was our role basically.
Right, sir. Sir, any last message to all those workers who work in this business?
Actually, message is just wait, maybe within a week or within 2 weeks, the kit is going to be available in the market. we have given permission to manufacture these two companies. One is Delhi-based company, one is Chennai-based company. Delhi-based company, they have made almost it is ready. They assured me just few days back. I had a talk, and he told by third week of January it will be available in the market. So once it is available in the market, government of Rajasthan, government of Chhattisgarh, government of Jharkhand, they are in touch with me, and they are very serious about control of silicosis and prevention of silicosis in their country with using this kit. And we are going to start one multicentric study also, the TB relationship between TB and silicosis. Multicentric study from ICMR, one in Agra, and there are two sites in Odisha and one site in Jharkhand. That multicentric study. And another important thing I like to say, in the TB, control of TB, when there is underlying silicosis, the control of TB is very difficult because there is a high chance of developing drug resistance, and drug resist TB, when it becomes drug resistant, it's very difficult to control, and once when it spreads to some other people, they also develop drug resistance. So for control of drug resistance also, this control of silicosis, drug resistance tuberculosis, control of silicosis is very important. So these are the scenario, these are the things we need to consider. We need to think of it seriously, how to control silicosis, how to, for both TB as well as silicosis, control of silicosis is very important. This is my message.
Thank you so much, sir. Thank you so much. It was really very nice talking with you. Thank you so much for your all the things you have told.
Thank you, madam.
Thank you, sir. Bye.